Well, bore da, croeso pawb a diolch am ddod. Good morning, everyone. Thanks for coming. Just to let you know that we'll be recording today's session, but wow, what a session we've got in store for you. Super excited to be launching today the Staff Health and Wellbeing Framework, a best practice guide for NHS Wales. This has been developed in huge amounts of partnership with input from experts across the system and beyond, and we've got some incredible speakers. So my name is Julie Rogers, before I get too carried away and excited with what we're going to be discussing. And I've got the pleasure of opening today's launch. I'm the Deputy Chief Exec and Director of Workforce and OD at Health Education Improvement Wales, and we're the organisation that are bringing you today's launch and this fantastic product. So today, as I say, we've got some great people lined up to talk to you. We've got Professor Michael West at CBE, and Michael will be joining us to talk about his reflections, but also for you to be aware that Michael is one of the experts that has helped us in finalising this amazing product. We've also got Claire Smith, our very own Claire Smith, who many of you will know. Claire is a legend, I once called her, in the Health and Wellbeing Network for NHS Wales, and Claire will be sharing some of her reflections and some of the work as we get later on in the agenda, and she'll be actually formally launching and walking you through the product itself. We've got Zoe Gibson. So Zoe's recently joined Health Education Improvement Wales, and Zoe is our national retention lead. So you'll see as we go through the morning that there is a synergy to all of these presentations, and they're all key elements from the best practice guide. And we've also got Deb Longman. So Deb has been leading a really another exciting project that HIW has been working on the last year or so, which is our Workforce Observatory. And Deb will be talking to us a bit about workforce design. And finally, then we've got Rebecca Cicero from Social Care Wales. And Social Care Wales are one of our key partners that have worked with us in developing this product. So I'm just going to set a little bit of the context for you, having whetted your appetite with the speakers to come. We're going to take questions in the Q&A section of Teams today, and we'll gather all of those up at the end, and then we will aim to answer them. But as you can imagine, with so many fantastic speakers, we want to make sure that we maximise the amount of time for them to share their views and knowledge with you. But we will come back to you with answers to some of your questions after the event. So in terms of context, some of you may remember that this was an action from the Workforce Strategy for Health and Care in Wales. That strategy was published in 2020 and has a 10-year life, so it runs until 2030, sorry, can't count this morning. So 10-year life, obviously we're in 2024 now, and this product has been worked on probably for about 18 months. Substantial amount of work, evidence-based best practice guide, and it's been developed in collaboration not only with our partners across NHS Wales, many of whom should be on the call today, but also with our trade union colleagues, with Welsh Government, and with experts in psychologies and other fields of healthcare. It is a best practice guide for organisations, and all partner organisations have signed up to it. So we're really confident that once it's been launched, it will be useful and used across NHS Wales in all of our organisations. And we've also mapped it then against all of our other national policies, strategies and enablers. So those of you who are aware of the National Workforce Implementation Plan published by the Minister a couple of years ago, that also made reference to this important piece of work. It links, though, also with other key pieces that we're taking forward in HIW, things like compassionate cultures and leadership, as I mentioned, retention, healthier working practices and compassionate people practices. So it is a coherent, really informative, evidence-based guide with a huge amount of content in there that will be relevant to everybody on the call. So today, the main purpose of today is really to raise awareness of the guide, to talk to you about some of the elements and the key components in it, to introduce you to some really, really important features and some key speakers, but also to get you excited and enthused. I was over the moon. Claire told me just before we joined the call that we had 1,476 views on our event page for this session this morning, and 254 people signed on. So that's absolutely fabulous, but it does really go to the heart of the importance of health and wellbeing for our workforce, and why we've been really proud to lead this work with partners across NHS Wales. It is absolutely fundamental that we look after our people, and we believe this will help everybody, whether you're an individual or an organisation or a manager or a team leader, whatever your role. We believe this will really help you in doing that and paying attention to health and wellbeing. And just briefly before I finish and hand over, I think Claire is going to introduce our next speaker. But I just wanted to say about this idea of individuals, because quite often I think we see in parts of our system people waiting for other people to look after their health and well-being. And I think it's really important that we take responsibility for our own health and well-being, as well as for self-compassion. And I'm sure Michael will talk about that. But increasingly, that's been one of the areas we've been looking at in HEIW. How do we give people examples of how they can be more self-compassionate? And how do we make people feel less guilty about paying attention to how they're feeling and their needs? Because that's super important. And you can't look after each other. Yeah, you can't look after others if you're not the best version of yourself that you can be. So we will be pushing that a bit today, and you'll see that as a key feature in the guide. But I'm absolutely delighted to be able to sort of say hello and hi to you all this morning. I'm going to be with you for the whole session, really looking forward to it. And diolch yn fawr and croeso, well done to the team. This is a fantastic piece of work, and let's crack on with the morning. So thank you, Claire. Over to you. Diolch yn fawr.
Diolch, Julie. Bore da pawb. I've got the great pleasure of introducing Professor Michael West, CBE, to our meeting. Morning, Michael. Oh, we can't hear you.
Bore da, Claire.
Yeah, we
Bore
can
da
hear you
pawb. Diolch yn fawr. It's a real privilege to be with you all this morning, and it's been a privilege to contribute to the development of the HEIW Wellbeing Framework, because the context that we're currently facing in the NHS in Wales is probably the most challenging context we've faced in its history, with vacancies, very high levels of stress, real challenges in retaining staff and recruiting staff. And we know that those levels of stress have a real impact on staff health and well-being. And, you know, it's a kind of paradox in a way that we're asking the nearly 100,000 people who work in the NHS in Wales, and we're probably talking about 250,000 when we add in social care, to promote the health and well-being and happiness of the people of Wales. But in the process, we're damaging the health and well-being of a large proportion of those who we ask to undertake that work. And we know also that those levels of stress and burnout are associated with worse care quality and much less safe patient care. So it is really important, I think, to understand the significance of the launch of the Wellbeing Framework today, focused as it is on ensuring the well-being growth and engagement of all staff in health and social care in Wales. Implicit in its design is the deep understanding that well-being of those who deliver care is the most important factor in the delivery of high quality, continually improving and compassionate care for the people of Wales. And as Julie said, it behoves all of us to take responsibility for looking out for the health of our colleagues and looking out for our own health. I'm really pleased that the framework has been developed in consultation with colleagues and communities across Wales. It's been a huge consultation exercise. And one thing that I've learned over my career is that so many initiatives, well-meaning initiatives, fail because they don't involve the very people who they're designed for. But that's absolutely not the case in relation to the wellbeing framework. There's been so much consultation, ensuring that its design is influenced by the experiences of staff, their expertise, their knowledge, their skills, their abilities, and their commitment to excellence. The other really important, I think, characteristic of the wellbeing framework is it's underpinned by a deep grounding in scientific evidence about well-being from all over the world, drawing on evidence from interventions that promote well-being that have demonstrated reliable and positive outcomes in health and social care context. And having that scientific base, I think, is fundamentally important. So after all, healthcare is an evidence-based domain, and we should be using evidence to develop this framework so that it makes most difference. And one example of that is that we know that the various interventions that are undertaken in organizations often focus on treating the symptoms of stress or promoting well-being, or they focus on helping people cope with stress more effectively. Much less frequently used are interventions that are focused on changing the workplace factors that cause staff stress, things like work overload, poor relationships with supervisors, poor quality of team working, conflicts between work life and home life. And yet the evidence, the scientific evidence tells us is that those interventions are the most powerful in bringing about improvements in the well-being of staff. So it's really important we focus on all of those interventions, but as the wellbeing framework incorporates a really strong focus on changing the work environment, then we need to make sure that we grasp this opportunity. And that's things like, giving people more voice and influence in their workplaces, creating cultures of justice and fairness rather than fear and blame and favoritism and secretiveness, and trying to improve the working conditions of staff and giving people more influence over flexible working and shift work. It's building more effective team working, which we know is a key factor in staff well-being. The more that people work in effective teams, the better is their well-being. It's, as Julie was saying, it's creating cultures of compassion and developing compassionate leadership. And I think, what's helpful, as Julie was saying, is you can think about the flows of compassion in three directions. There's the compassion we show to those we provide care for and those we work with. There's the compassion that we show to ourselves. And then there's also the compassion we receive from others. And all three of those flows are really important for well-being. So the well-being framework makes a huge commitment to continually reviewing and developing the content to reflect the latest research evidence, drawing on models of effective practice that we find out about, which are occurring all over Wales in health and social care, and carefully building on the experience of staff across the country. And the National Staff Survey is going to provide us with a huge amount of intelligence about how we're succeeding in promoting the health and well-being of staff in Wales. The framework will play a vital role in protecting and supporting and enabling all health and social care staff in Wales for the benefit of all of the people of Wales. After all, in the end, our ability to deliver high quality, continually improving and compassionate care for the people of Wales is fundamentally dependent on the extent to which we're delivering high quality, continually improving and compassionate support for staff. So thank you for involving me in this hugely important initiative. Diolch yn fawr.
Diolch yn fawr, Michael, and thank you very much for being involved and providing your endorsement. And you're absolutely right. It feels after 23 years of working in the NHS, it's the most challenging time, and I'm really, really pleased that all these initiatives are going to help to support staff. So thank you very much, Michael. And now I'd like to introduce Zoe Gibson, our National Retention Programme Lead. Welcome, Zoe.
Good morning, pawb. Thank you for inviting me today, Claire. It's really, really exciting to be involved in the launch of the best practice guide. So I just got a few slides to take everyone on a bit of a whistle-stop tour of the retention programme in Wales, which has recently been launched. So we'll just wait for the slides to come over. There we go. You can just let me know. Can you see the slides there?
Yes.
Yep. Fantastic. Okay, so as Claire said, I'm Zoe Gibson. I'm the National Retention Programme Lead based in HEIW. But I'm part of a wider team, which I will describe, many of which are actually on the call today. So it's great that the retention leads are actually coming together for this as well. Okay, so retention, why is there the focus and what is the case for change? So workforce challenges are considered the greatest threat to the health service at the moment, and I don't think I need to preach to the converted regarding the challenges that we all face from a workforce perspective. However, there are complex challenges that are multifaceted and are putting great strain upon services as a whole. The situation has been further exacerbated by the COVID-19 pandemic, with more staff opting to leave their roles year on year, and also a high number expressing wish to leave the NHS. Workforce challenges, however, don't stop at the borders of Wales or the borders of the UK. They're actually a global problem, and we can't just rely on the traditional models of continuing to recruit. We need to really start doing things differently. We need to innovate, and most importantly, we need to retain. So before we can decide how we attack our retention issues within Wales, it's first really important to understand why people leave. So some of the examples here have been taken from several studies and surveys in a variety of professions, and there's always the same multifaceted themes. I shan't go through them all, but as you can see, staff health and well-being is at the core of the majority of those problems.
Can you see the slides okay, everyone?
We've
No,
lost
Zoe away.
We've lost
lost
Zoe on the
Zoe.
slides.
Yeah, try and call her back.
Please
Just
bear with us.
just while we're waiting, Claire, we were talking about with workplace factors we need to improve, and one of the major ones is chronic work overload. It's an issue I think we do need to address, and I know you have put a lot of work in the wellbeing framework into how we address issues of chronic work overload and improving management and supervision and giving staff the opportunities for continuing learning, growth and development. We know that that's one of the key factors in retaining staff. If they're able to continue to learn and develop their skills, they're more likely to stay. And I think the evidence we have is that chronic work overload is the number one factor in staff stress. And after retirement, the number one reason why people leave the NHS. So it's a really important issue to address. And the wellbeing framework, I think, has squarely, confronted that really important issue.
Thank you, Michael. Thank you. And welcome back, Zoe. We lost you into
talking
the
of
ether.
staff stress then, I'm not quite sure, just completely IT-wise fell out. So I shall resume
Thank
the
you.
presentation now, sorry. And thank you to Professor West there.
Teamwork, Zoe, teamwork.
Very compassionate.
Okay, the slides are making their way to you, but I can keep talking anyway without the PowerPoints if necessary.
We can see them now.
Oh, fantastic.
And you're on the right page.
Yay. Okay, so what are we doing within Wales? Well, we're obviously developing and delivering our national retention programme, and that programme focuses on improving staff experience at work whilst recognising and mitigating the factors that affect it. So to give a feel of some of the areas of focus that we're working on at the moment, it's that of compassionate leadership. We all know that's the golden thread to improving staff and wellbeing and also to improve retention across the country. It's relating to flexible working and the need to attain a suitable work-life balance for people across NHS Wales. It's about valuing our staff, putting their health and well-being at the centre of all we do, providing opportunities for professional development and robust career planning. It's about supporting new starters and those in new roles to have formal and robust induction throughout their working career. And it's also about recognising the excellent work and the superb care that is given across Wales, and not always focusing on the more negative aspects. So how have we formed the programme? I alluded earlier that it's not just myself leading on this programme. We're extremely fortunate within the programme to have had funding for local retention leads to be placed in post in all health boards and trusts across Wales, and I know several are online today. We're very much a new entity, and I think our last retention lead has actually come into post as of today, so that's very exciting. So the aim of the retention leads working together is to provide both national and local leadership to enable us to innovate and improve retention practices in partnership across Wales. So to achieve that, we'll be establishing a retention community of practice. And I'm sure all of you online know a community of practice is an approach that enables social learning and promotes innovation, improvement and collaboration and collective approaches. So we'll be establishing that within the next few weeks, and with the aim of celebrating best practice that's already in place across Wales, but actually sharing it so that we can spread and scale that good practice that's already happening, and also to take on the challenges that we face nationally from a retention perspective, to work together to find workable solutions that improve the landscape across Wales. As I mentioned, compassionate leadership is essential, and the way we'll be delivering the programme is obviously cognizant of the values and requirements. So to support the programme, we've already developed several key tools and resources. And I say we, I wasn't in post, so this is a big shout out to colleagues across HEIW who've worked on this prior to my commencement. So we've got the Improving Retention Together, the retention guide. So that is full of information, tips and tricks and resources to improve retention within organisations across Wales. We've developed the digital retention self-assessment tool that can be used again by all organisations to assist them in identifying a baseline from a retention perspective, both at an organisational, site and departmental level, which will then help the development of localised retention plans. Mentioning retention plans, in addition to the organisational retention plans, we're also working with multi-professionals across health to instigate the requirements and to develop the required retention plans, the first of which has been launched, and that is the nurse retention plan, but it will be closely followed by others. And then to bring all our resources together, we have developed an All Wales Retention Hub, which has all our key resources, contact details of the retention leads, and a great deal of evidence-based practice to support each other. Obviously, this will be a developing hub, and there'll be more and more information available on that. So that's going to be housed within the Gwella portal for the project going forward. So as you can see from the Whistletop tour here, health and wellbeing is key to retention, and everything that we're doing is focusing upon the improvement of that. So the best practice guide is aligned with the core interventions required to address retention challenges we face, and will definitely be a key resource within our hub going forward. It's aimed at it'll help support us educate colleagues of the importance of supporting staff's wellbeing. It's about providing a system-wide, sustainable, evidence-based approach to staff support and wellbeing. It's about supporting a sustainable approach to compassionate leadership and retention. Ultimately, the guide will help us to retain staff and ensure that Wales is able to give the excellent compassionate care that it deserves. And I shall hand back to Claire. So that's great. Thank you, Claire.
Oh, diolch, Zoe. Thank you for your presentation. And it's just to say all the enabling resources that Zoe has just highlighted are all linked in the best practice guide to make sure that there's no duplication and there's maximum sharing of information, and that the guide and the retention enablers have been mapped to one another. So it's great. Thank you. Thank you very much, Zoe. And now if I could introduce Deb Longman, who is our Programme Manager for establishing the Workforce Observatory, which is also a significant part of the guide. So Welcome, Deborah.
Thank you, Claire. Bore da pawb, and thank you for asking me to come and speak today. I am absolutely delighted to come and share the work that we've been doing on establishing the HEIW Workforce Observatory. As we know, as part of the framework, health and wellbeing is really, really important when you think of workforce design. So by sharing the observatory with you today, I'm hoping that, that will guide you into some areas that you can look at to improve your own approaches locally. So what is the HEIW Workforce Observatory? It's a public-facing web resource, which is a first stop for all strategic workforce planning. But built into that as well is also a community of practice, which will support NHS staff in their learning development CPD. And it also provides access to really key data and analytics to support workforce planning. So we know that health and wellbeing is a key focus when planning and designing a workforce. So who is the observatory for? Basically, anyone who has an interest in workforce planning. So it's not just our strategic workforce planners, it's also our service improvement managers, our senior nurses, our public sector managers. Because we know, as been mentioned by Zoe just now, is that the way that we've got to look at the workforce, it is going to have to change its shape, because we can't keep relying on recruiting when we're in a global crisis when it comes to recruitment and retention. So we need to consider the shape of our workforce as well as the design of the workforce. So what does the Workforce Observatory contain? So we have the public-facing observatory, which is hosted on the HEIW website, and this is available to absolutely anyone who has that interest. We also have our data and analytics portal. This is for NHS staff only and is hosted on SharePoint. And we also have our community of practice, again for NHS staff only, which is hosted on ETDusky, the National Learning Platform. And it's been a brilliant collaboration from different teams within HEIW to bring this together, and also further collaboration with the wider workforce teams within the health boards to get this established. So as I've said, supporting health and wellbeing is really, really important, and it weaves through all aspects of workforce planning. And we've, as part of our community of practice, we've launched our competence framework, which has been designed for people to self-assess where they are now and where they need to develop, with resources signposted then to assist with their learning. So it's all very well and good me telling you about it. Let me show you how you can find it and what you're likely to see. So I'm hoping everyone can see the HEIW website there. So if we go under the Workforce tab, you'll see the Workforce Observatory. So included, we have our workforce plans. So all of our plans that have been published, all ones that are in a decent stage of development, are included here to help inform your own work. We have a wide range of workforce planning resources, so key workforce planning documents to help you. We have the competence framework available publicly within there, and we also have some information on the census, which gives really key information about our populations, how our population is ageing, how we're struggling with younger people, with the birth rates coming up, which of course is going to impact our future workforce. We have a section there on understanding the workforce. Within there, we share workforce trends, labour market statistics, and a lot of key Welsh Government documents which underpin a lot of the work that we do, and other documents and sites that you may find useful. moving on to the bottom line, the research area we are yet to develop. This is something that we are working closely with partners. We have our data analytics portal, but I'm going to click first onto the community of practice, because this is where we host our training and development, which is an introduction to strategic workforce planning. And it's a course that you can work through in your own time for your own development. And we've also got, as I've mentioned, the competence framework where you can use your self-assessment. We've got lots of really key resources, workforce planning principles. So just want to click on the resource library. So the first time that you go in, it'll take you to this page. If you haven't got an ETDusky account, you can sign up at the top there. But if you have already established an account, it's a one-stop sign-in. You can choose to sign in with your NHS Wales account. So just click on that and I'll take you straight through. So I just wanted to quickly show you what our resources library looks like. So you can see within strategic workforce planning, we've got at the moment 148 different resources. That includes masterclasses, documents, videos that you can watch. And on the left-hand side, we can see that if there's a particular area that you're interested in, it has been fully curated and it has been like categorized to help you find things that are more suitable for the work that you're currently doing. And taking you back then, we've also got an access then to the data and analytics portal, which has been designed by the data and analytics team here in HEIW. And this gives a number of different dashboards, which again, you can interrogate information. And one of the ones there is our newly published population dashboard, which looks at the census data, but it puts it in that frame of your health board areas and also your local authority areas. So it really does break down some key information, which will really support your workforce planning there. So that's just a very quick tour to show you the Workforce Observatory and how important that is really in supporting workforce design to incorporate health and well-being. So diolch all, thanks for inviting me. And if anyone's got any questions at all, feel free to contact me. Many thanks. Thanks, Claire.
Diolch, Deb. Thank you very much. And invited Deb today because workforce design is one of the domains within the best practice guide, as planning your workforce, designing your workforce is crucial to any kind of design that you do for patient services, and it has an immediate impact on staff health and well-being. And if we want our patients to get the best care, we need to make sure that the staff around them delivering that care are configured in the best way for them to thrive. So thank you very much, Deb. And I'd like to now introduce Rebecca Cicero, who is our Improvement and Development Manager for Adults in Social Care Wales. And I've had the pleasure of working with Beck for a number of years now on their Social Care Wales health and wellbeing framework that they developed, and Beck has also been sitting on our group to support us to ensure that the health and social care workforce of NHS Wales has the correct support that they need. So thank you, Beck.
Thank you, Claire. I'm just going to try sharing a presentation now. Don't worry, it's not too many slides. Right, can everyone see that okay? Brill, I can see Claire nodding. So Bore da pawb. Diolch, thank you for inviting me to come along today. As Claire said, my name's Beck Cicero. I work for Social Care Wales, so we regulate and support the social care workforce in Wales. And as Claire said, we've been working alongside HEIW now for a number of years on supporting staff wellbeing. So what I wanted to share with you today was the work we've done on our framework and a little bit of our experience and some lessons learned that are hopefully helpful for you as well. So just to give a bit of context, we do have a joint ambition with health set out in the joint workforce strategy to create an engaged, motivated and healthy workforce. So that's where our work on wellbeing has really started to ramp up over the last few years. So we have been working closely together, contributing to each other's work. So a big thank you as well to all the learning we've taken from health in developing our own framework. And as Michael and others were speaking about earlier, all of this as well is underpinned by compassionate leadership. The two go hand in hand. To lead and improve on staff wellbeing, we need to understand compassionate leadership as well. So that's very much linked in and underpinning the approach that we're taking. And although we've developed two sort of separate frameworks for health and social care, underpinning it, it's all the same approaches, similar evidence, similar learning, because as we know, a valued and supported workforce does as well lead to better care for people who are accessing care in social care as well as those in health. So what we have developed in social care is the Your Wellbeing Matters framework. The link is in the, I don't think I can put the link in the chat, but the link is on the screen as well. But you can just Google Social Care Wales Wellbeing Framework to take a little look at that. And this framework is aimed at anyone working in the social care, early years and childcare sector. So when we say the sector, that could be local authorities, that could be independent or private organisations or settings that deliver social care, early years and childcare, and obviously covering a huge range of roles and different ranges of responsibilities within the sector. This could be people who are self-employed as childminders, some may be volunteers, and then the paid workforce as well. So what we've tried to do with our framework is really set out and present the case to the sector about why wellbeing at work is important and the difference it can make, underpinned by evidence and understanding of what impact a good workplace has on your staff, but also to provide some helpful resources and signposting for people to help them to move towards a workplace that supports wellbeing at work. So our framework is based on 4 key commitments. They are creating safe working environments which are continuously improving and supporting health and wellbeing. So that covers things like your policies, your procedures, your ways of working, as well, not simply your health and safety legislation, but looking more holistically at the whole person as well. What is that environment like when I walk through the door? What's our workplace feel like when I walk through the door? And how is my organisation set up to support that? The second commitment is about fair treatment, dignity and respect for all. So that's ensuring that no matter what people's particular circumstances are, that they are supported to work and work well and supported by their organisation and managers. The third is about establishing workplace cultures where everyone's informed and involved. We know that people who feel part of an organisation, valued by involved in an organisation, that they have a voice within that organisation, feel much more valued, feel much safer. And the final commitment is around prioritising a culture of continuous learning and development. We need to create workplaces that support its staff to learn, grow, in a variety of different ways. Not everyone loves a classroom. Some people like to learn in different ways. So it's trying to create environments that support you to thrive, grow and feel inspired to work for the organisation you work for. And then the framework itself is split into 3 categories with sections that say what I can do as an organisation, as an employer, what I can do as a manager, and what I can do as an individual, because we see this as a collective approach. It's not all simply on the individual to come to work and feel good about their well-being. It's about that whole system and that whole organisation and the different ways in which we can support each other. So the way we've approached things so far is we launched our framework in October 22. October 22. So it's been about 18 months now. And since then, we've been trying to build our networks, our communities to support rolling out, understanding and promoting that framework. So we've created an online community of practice to help people to come together to talk and share ideas and practice around workplace well-being. We quickly realised as well the need to really describe what we meant by workplace well-being or good workforce well-being. Early on, we realised that people felt that it was about some of those individual over there interventions and that people needed to take and people feeling too personally responsible for things. So we've been spending some time since the launch as well, trying to develop and improve our messaging to say that actually good workforce well-being is a responsibility of everyone. And it's about those workplaces that you walk into. It's the way in which you walk through the door as well. So we've created some campaigns with short videos to try and reiterate some of our messaging, which we shared on social media, and also different ways of trying to convey this. So we've developed some e-learning modules as well to help people maybe try and absorb the information and understand what we're talking about in a different way as well. We found that there's been more of an ask for information and learning sessions. So this was something that we did as part of our wider work, but we've started to align this more to the framework and to the topics within the framework to help people make those connections through any information sessions, workshops, learning sessions that we are providing to the social care sector, that there's an obvious link back then to what that is saying within the framework as well. We've also learned that continued promotion is important. You can launch something and it can get lost. So we try to continue then to drip, I guess, the information about the framework is existent and any linked sort of offers of support and activity through things like regular bulletins to staff and trying to identify those opportunities for regular communication with the broader workforce that keeps this on the agenda as well. And the last thing I get to reflect on was around our connections. So this has been a great way, a great sort of opening point to help us connect with the sector and share some of that practice. As I mentioned earlier, developing those communities of practice, developing those safe spaces where people are able to just share some of those small steps that they've taken. It doesn't have to be a big bang, and you recognise that a lot of the time with frameworks and with new ways of working, that is the slow move towards change. So it's about finding a place you can share and celebrate some of those small wins as well. So what we've seen really since launching is an increase in awareness of the framework, and the way in which we do that is to try and monitor visits to our web pages where the framework is hosted, so that we can see whether or not there is an increase in awareness. And so I think one of the things we've learned is good analytics from the start. So if you want to measure, I guess, how this is going and how that awareness is going, one of the things that we would have done differently at the start is improve, I think, some of those metrics and those the way in which we collect data to make sure that you are monitoring and seeing whether or not you're seeing any indications that people are visiting or are aware of that framework. We've seen increases in visits to our broader web pages since that, which offer broader support around health and wellbeing, an increase in demand for some of our learning sessions, and also increase in requests for some more bespoke help in our offer. People will always need that chance, I think, to talk to someone about how this works and to share ideas. So it's a great sort of, the frameworks, best practice guides are a great way, I think, to engage people with that broader conversation and to open the door for people to feel like they can have a chat about this, because often people find that they've done some things, they've already partly on that journey, and they just need someone to talk through and some help and support with moving forward and growing it more widely. Oh, not moving on. So I think the final thing I'd say, some of the biggest tips we can share with you from our experience is really have a good sales pitch. So have a good evidence-based sale pitch that demonstrates those links. For example, you've mentioned between retention and well-being, to help people understand why this is important, because if there's one thing we've learned is that not everyone will recognise that from the start. And don't assume everyone gets it. People have different perceptions of what well-being means. So we've spent a lot of time going back and creating the messaging of a collective supported approach, because everyone interprets those words differently. Have quick and easy ways and clear ways to gather feedback and make it as short and as simple as possible. That's one thing we've learned, and we've gone back when our interactions on the framework through information sessions, etc., is that we've learned that actually some just simple little feedback forms can help you get a little bit of a better understanding of whether people are starting to understand what good workplace wellbeing means, and encourage that sharing, encourage people to come together to share their ideas, share some of those small wins in a community that feels safe and supportive as well. So that's our key lessons and our key learning really from everything that we've done so far. So if anyone does want to speak to us about our experience or hear about some of the things that we're doing, good and bad lessons learned, then you're more than welcome to contact us on wellbeing@socialcare.wales. So that's wellbeing@socialcare.wales. And we'd be more than happy to share and support anyone along this journey as well. So diolch yn fawr, thank you very much, and congratulations on the launch of an absolutely fantastic piece of work as well. Thank you.
Thanks, Beck. Thanks very much. And just to let everybody know that the Social Care Wales Health and Wellbeing Framework is in the Best Practice Guide. It's in the strategy section, and there's clear links to it. And Beck and I and our teams will continue to work together going forward to ensure that there's some real synergy between the two frameworks for health and social care. So thank you very much. So it's now my time to share my presentation. Okay, can I get a thumbs up? Great, thank you. Thank you. So, Claire Smith ydw I, a rydw wedi bod yn gweithio mewn lles a iechyd y gweithlu nawr am mwy na 7 mlynedd ac yn yr NHS am mwy na 20 mlynedd. So, hello, I'm Claire Smith. I've been working for NHS Wales for 23 years, and I've been working on the agenda of staff health and wellbeing for over 7 years. I'm the head of organisational development and wellness in Health Education Improvement Wales, but I'm also the lead for the NHS Wales Staff Health and Wellbeing Network. And I also sit on the UK Health, Safety and Wellbeing Group, and also on the Social Care Wales Health and Wellbeing Advisory Committee. So it's a real pleasure to bring this guide here today. And there's going to be lots of thanks for all the people that have been involved in developing it. I'm the face presenting it, but by no means this has been a solo ride. So to attract, train, develop, retain and plan the workforce for now and for the future, there is an urgent need to anchor staff health and wellbeing in all that we do, in the systems, processes and fabric of the NHS. It's still important that we provide staff health and wellbeing resources in the form of interventions and preventions. However, this approach alone will not sustain the workforce. To ensure that staff health and wellbeing is front and centre of all the decision making, there needs to be board accountability and responsibility at all levels. And decision making must centre on the health and wellbeing of staff that are delivering the service for our patients and communities we serve in Wales. The best practice guide has been designed to support staff to thrive at work and to enable and encourage them to meet their full potential and have an optimal experience at work. So Zoe also talked about the case for change, and it's very evident that it is a very challenging time for our workforces, and there's overwhelming evidence that staff health and wellbeing impacts directly on staff experience and staff engagement. And that also then impacts on organisational productivity, individual performance, and ultimately the quality of patient care and outcomes. So this isn't an optional. If we want the best care for our patients, then we need to take notice of all this evidence and take action. We're very fortunate in Wales that we've got a number of national enablers. So health and wellbeing is based around the culture of how you work, and culture, one of the enablers of that is leadership. So the best practice guide has been developed and aligned to the compassionate leadership model, and it is intended to sit above local staff health and wellbeing strategies and workforce and organisational strategies. And what I mean by local is the 13 NHS organisations in Wales and Health and Social Care Wales. So, as it's been mentioned earlier, this has been developed in full collaboration. So we've been meeting now for 12 months. But before that, there was an awful lot of groundwork put in place. So the Health and Wellbeing Network for NHS Wales has been running since 2016. And it's got over 100 members, experts and members of the workforce and OD community, clinical psychologists, heads of wellbeing services and occupational health, and in partnership with trade unions and Social Care Wales and Welsh Government. It's based on all the evidence that's available to us, and it's been developed to be a high quality, reliable, evolving resource. It will sit on the Gwella portal, and it will be organic and will be added to as new emerging research and evidence presents itself, and will be added to in terms of best practice guidance and sharing of best practice. It links very clearly to the Workforce Planning Observatory, the Compassionate Leadership Hub, the Retention Hub, the Healthy Working Wales Hub, and the work that's currently underway for the Compassionate People practices. It will also link to the HEIW Health and Wellbeing website. As I mentioned, it's been aligned to the compassionate leadership, and therefore it was essential that we had the critical review and endorsement of Professor Michael West. So it's got a number of domains, and each one of these domains contains key factors that impact on staff health and well-being based on all the evidence and research that we currently have. It's very comprehensive, and today I'm just going to be giving you a very high overview of what is in each of these domains. However, you will get a link. There will be a link at the end of this presentation to the site as it goes live. So relationships. This is just a number of the areas within this particular domain. And one of the ones I wanted to bring your attention to was team working, as it's been proved that it's fundamental to the effective delivery of healthcare, and it's associated with higher quality of care, better staff well-being, higher level of patient satisfaction, and lower levels of avoidable patient mortality. We must promote a culture, a workplace culture, which does not discriminate on any form, and that it is not tolerated, and that positive action is taken. It's really important that we create the right environment for staff to feel safe to speak up, one that focuses on learning rather than blame, that increases knowledge and creative ideas and experience available to our decision makers. Making work work. This is our second domain. Some of the areas in here is that we have agreed minimum standards for facilities, working conditions and work schedules, especially considering the chronic excessive workloads currently experienced by staff. Workload demand and pace should be regularly reviewed and monitored at all levels up to the board. We need clear strategies for continuing professional development across professional occupational groups to increase interprofessional learning and the specific needs of different roles. We must promote a culture of positive behaviours at work to enable and encourage healthy conflict and fairness. All our operational processes and policies should be human focused and avoid harm. We must manage change well. If we change managed badly can impact immediately on staff health and well-being and therefore patient outcomes. We must ensure that our infrastructures that support staff to practice with a high level of autonomy and to be fully engaged in organisational decision making. And we must ensure that systems are in place to enable and encourage staff to raise concerns about their work environment, any uncertainties or conflicts they have about their roles and responsibilities, and any unacceptable behaviour. Our third domain is workforce design. And as Deb has mentioned, organisations need to plan their workforce based on the needs of their population for the short, medium and long term, and effectively deploy and utilise their workforce. Resources to support organisations to do this are in the observatory, and there's direct links from this domain. Where possible, the different requirements it places upon employees, we must ensure that they're compatible and are well matched to their job descriptions, and the expectations that we put on staff are clear. We're clear on their roles and we're clear on responsibilities. To ensure well-being and motivation at work and to minimise workplace stress, people have three core needs: autonomy, belonging and contribution. And this guide contains three best practice. The role of managers and leaders in contributing to organisational culture cannot be overemphasised. These key elements include fostering compassionate cultures and embodying compassionate leadership. This domain details the role that managers and leaders can take in supporting staff and health and well-being. Those who ensure a culture of well-being, continuous improvement, openness and psychological safety will create healthy work environments where staff and therefore patients will thrive. All staff have a responsibility for their impact on others and an understanding of how their behaviours affect those around them. Whether they formally manage or lead, how they interact will affect colleagues' health and well-being. The NHS Wales Staff Health and Wellbeing Network identified 3 areas that, for national products. And the first one, which we're launching with the launch of the guide today, is a financial wellbeing playlist. And this has been built, it's a tool of best practice and has been developed in conjunction with the Money and Pension Services. There's other bundles which will follow shortly to support stress in the workplace and menopause. So I would just like to say and make a plea that staff health and well-being is based on the individual. It's based on them taking positive action and making a commitment. 1, to be self-compassionate. 2, to be compassionate to others. And 3, to receive compassion. So here is just some of the graphics from the guide. Really pleased with our communication team who've developed these, and they are aligned to the compassionate leadership ones as well. And just to explain to you, we've got a HEIW Health and Wellbeing website, which has got all the resources on. We didn't want to lose that. It's still important that we have those interventions and preventions and those resources. So that as you land on the page, you'll see that on the left-hand side, there is resources for staff. So you click on that and it'll take you to all those resources that were curated during COVID and have been added to since. And then on the right-hand side, you've got the best practice guide for organisations. Each one of the domains has a takeaway, and as you can see, each section has one, so that you can even print these out and take them with you. So if you're not logged in, I mean, obviously it's an interactive guide and it works best on the Gwella portal. However, if you did want to sort of download and email or share some of these best practice guides, takeaways, you can. So I'm just going to stop sharing now. And the Q&A was going to be placed in the link to the guide is going to be placed in the Q&A for you to access. I just wanted to say a massive thank you to everybody today for all your help and support, to our wonderful presenters, for those that have helped to map this document against strategies, and to my team, Sian and Laura, who work so hard behind the scenes, making sure all this happens, and also to our digital team, Joe and Renee. So thank you very much.